Let's take a moment, and we can go back and forth with the dialogue here for a moment about the American economy. This debate has been focused principally on individuals and families and the effect of this of our program and how it will help families. Prior to the last month or so, there was a debate in America, at least there was a discussion in America about the effect of health care and the cost of health care on the American economy. I don't have a diagram here. I thought I would bring it, but it didn't get over here. And it's the fact that the American economy, we're now spending somewhere close to 17% of all of our wealth, our GDP, on health care. It's an extraordinary number, particularly when you consider what other economies are doing around the world. Our competitors, Japan, Korea, the European countries, all of the European Union countries, have universal health care. All of the people in their society, including visitors, have access to health care. They've got universal health care. Their health statistics are better. They live longer. They're healthier. They don't have as many diseases. Their children don't die as often as our children die. So, yet, the most any of those countries spend is 11%. Most of them are 10% or 9% of their total wealth. So we are in an extraordinary disadvantage. One of the numbers I heard is somewhere like it's writing a check to our competitors for about $800 billion a year, advantage that we're giving them in our economy because we're spending so much more on a healthcare system that is so grossly inefficient in so many, many ways. Part of what is taking place with the reforms that we're putting forward here is an effort to hold down the cost in many, many ways, including making sure that people have access to health care in the most efficient, effective way. Not waiting until they are very, very sick, uninsured, very sick, going to the emergency room, which is the most expensive place, and being extraordinarily sick when they arrive, but rather getting preventative care, getting the early care. I'll never forget a young man, about 35. We were doing this debate about 4 years ago in California, and he came, and he was a speaker at this thing, and he said, I want you to know that I am a glazer. I put glass up in buildings. That's my business. I put glass up in buildings. And I worked for a company for 12 years. We had good health insurance. And the company hit upon a hard time, and so they cut the health insurance. And they then decided that they would reduce our health program. I said, I'm a healthy young guy, and I've got good health, but I'll get my children covered. So he covered his children, and he eliminated his own coverage. He came down with a cold. Simple cold. The cold got worse. He didn't have coverage, so he didn't go to get care. Cold got worse. He wound up with pneumonia. And he wound up then with a collapsed lung. Hospital for 3 or 4 weeks. Became bankrupt. What could have been taken care of with a very simple antibiotic that would have cost $50, it became a $50,000 event. This is happening across America. Those 45,000 people that die every year, this is the young man that didn't get care. This is the extraordinary cost in our system because we don't cover everybody. We intend to deal with that and over time bring down the percentage of our economy that we're spending on health care as we make it more rational, more universal, and more efficient.
You know, those are the tragic stories that result from our healthcare system. But there's also enormous lost opportunities. One of the things that we know about our healthcare system is people get locked in jobs. They may dream about creating something, a really innovative product, or starting a new business and becoming a great artist, thinking of a new invention that will transform medicine or energy, but they're stuck in their job. A Canadian was telling me about the incredible freedom that people in Canada have to innovate, to experiment, to create, to do all the things that so many Americans, because of our healthcare system are unable to do. If America, the United States of America, wants to be number one in innovation, we want to release that creative spirit and that spirit of innovation which is trapped in a job because of healthcare.